Hello, and welcome back to the Wellness Pharmacist with Dr. Kat. I'm Dr. Kat, your host. And in today's 5-minute focus, we are reviewing a study published on January 19th, 2025 in Arthritis and Rheumatology about the link between the gut microbiome, hyperuricemia or high uric acid levels, and gout. We often think of gout as a condition caused by diet. So too much red meat, too much alcohol, or too many sugary drinks. But this research suggests a deeper connection. The gut microbiome may play a crucial role in how our bodies process uric acid. So let's break it down. This study looked at how gut bacteria influence uric acid metabolism and how changes in our gut health might contribute to hyperuricemia, which is gout and gout flares. Hyperuricemia happens when the body either produces too much uric acid or doesn't eliminate enough of it through our kidneys. And over time, this leads to uric acid crystal buildup in our joints, most notably in our big toe joint, so our metatarsal. And this is extremely painful condition, even where I've seen grown men that if you put just a thin sheet over that joint, they scream in pain. So it's nothing to laugh about. The gut microbiome connection, though, there are certain gut bacteria in our guts that help break down purines, compounds found in foods that contribute to this uric acid production. And when gut bacteria are imbalanced, what we call dysbiosis, the body may struggle to process and then excrete the uric acid, leading to higher levels in our bloodstream. Researchers found that people with gout had lower levels of beneficial gut bacteria and higher levels of pro-inflammatory bacteria. So this means that the health of our gut may impact our risk of developing gout and possibly even how severe the flares are. So the gut microbiome consists of trillions of microorganisms that reside in our digestive tracts, playing vital roles in digestion, immunity, and overall health and well-being. There is a connection between the gut and our mood, even. So this study highlights how certain gut bacteria are involved in metabolizing this uric acid, the substance that, when it accumulates, leads to gout. Key insights include uric acid degradation. So approximately 1/3 of uric acid is processed in the gut by specific bacteria. These microbes convert the uric acid into compounds like xanthine and short-chain fatty acids that aid in its elimination, so we can get rid of it. There is an impact of antibiotics that they've noted in this study. So they found that using antibiotics targeting anaerobic bacteria can disrupt the beneficial microbes and then potentially leading to higher uric acid levels and an increased risk of gout. This underscores the significance, obviously, of maintaining a healthy gut microbiome for effective uric acid metabolism. The study identifies specific bacterial strains that play a protective role against hyperuricemia. We've got Lactobacillus paracasei X11. This strain exhibits excellent uric acid lowering activity by degrading nucleotides and purines, thereby then reducing serum uric acid levels and then inflammation. We have also Eubacterium eligens. This is known for its anti-inflammatory properties, and this bacterium contributes also to the breakdown of pectin and supports gut health, potentially influencing uric acid metabolism. Pectin you can find in apples, by the way. These findings suggest that fostering these beneficial bacteria could be a promising strategy in managing and preventing gout, which would always be great. So what were the key takeaways? Patients with gout had a distinct gut microbiome composition compared to healthy individuals. So they had fewer bacteria that help metabolize the purines involved. Inflammatory gut bacteria were more common in people with frequent gout flares, suggesting obviously that gut health plays a role in triggering symptoms. And then probiotics, which I know a lot of people hear that word all the time now, and dietary changes may help manage uric acid levels. So some strains of beneficial bacteria were found to improve uric acid metabolism and reduce inflammation. The bottom line here is that the gut microbiome might be a new target for gout treatment, potentially through probiotics, prebiotics, or dietary changes that support beneficial gut bacteria. What do these findings mean for you and for your healthcare provider? Well, for people living with gout, gut health matters. I don't care if you have gout or not, gut health matters. So taking care of your microbiome, your guts, with a high fiber diet, fermented foods, and possibly probiotics could support uric acid balance. Obviously, talk to your doctor first before you try anything. Maintaining a healthy gut microbiome is critical. Incorporating probiotics containing beneficial strains like Lactobacillus, paracasei, and consuming high fiber foods that support this Eubacterium eligens, the anti-inflammatory component, can aid in uric acid management. For healthcare professionals, it's essential for us to consider the impact of antibiotics more on our gut health. And we do this anyway. It's just something that we really need to hone in on. Prescribing antibiotics judiciously and then recommending probiotic supplementation when necessary can help preserve beneficial gut bacteria involved in uric acid metabolism. And a lot of pharmacists out there that I know, when an antibiotic is prescribed, do recommend over-the-counter probiotic supplementation, because this does help with a lot, not just gout, but with other things. This study highlights the gut-joint connection. I've heard about the gut-brain connection, but it does highlight a gut-joint connection and suggests modifying gut bacteria could be a future strategy for managing hyperuricemia. And also, healthcare professionals out there listening, consider gut health alongside, obviously, traditional gout treatments like allopurinol or febuxostat, which could provide better and more holistic care. These insights then pave the way for integrative approaches to gout management, emphasizing the role of gut health. Now it's time, my favorite time, for listener question. And we have one from Melissa from North Carolina. I have gout and want to improve my gut health. What foods should I focus on? Thank you so much, Melissa, for this question. Supporting your gut microbiome can be an extra tool in managing gout, and that's what we basically said. Here are a few gut-friendly foods to consider. I mentioned high fiber foods, but let me be more specific. We have oats, lentils, beans, and there's all variety of beans, navy beans, kidney beans. We have black beans and chickpeas and just all sorts of things. And also leafy greens. They help beneficial bacteria thrive. Number 2, fermented foods. Let me be specific. Yogurt, kefir, sauerkraut, and kimchi contain probiotics that I was talking about, which is helpful. We want to make sure that we keep the sugar content down. So if you're looking at particular yogurts or, sauerkrauts and stuff, we want to make sure, especially the yogurt, that the sugar content hopefully is closer to less than 10 grams per serving. And then prebiotic foods, specifically garlic, onions, and bananas, feed that good bacteria. We want to avoid excessive sugar, like I said, and processed foods that can promote inflammation and gut imbalance. Remember, gut health is just one piece of this puzzle, so always check with your doctor before making any dietary changes. And then another listener, Sarah from Ohio, asks, I've been prescribed antibiotics for an infection, but I also have a history of gout. Should I be concerned about the antibiotics affecting my gout? Great question, Sarah. So certain antibiotics, especially those targeting anaerobic bacteria, like I said, can disrupt gut microbes that help metabolize and break down uric acid, and then potentially leading to not just gout risk, but in your case, a flare. So it's important to discuss this with your doctor and inform your healthcare provider about your gout history. And yes, they have it in their chart, but sometimes they get in a hurry. So it's always nice to help your physician out here. They can choose antibiotics with minimal impact on your gut microbiome, and then support your gut health. So consider taking probiotics during and after antibiotic treatment, and that then would replenish the beneficial bacteria. And in this case, talk to your doctor, but also really talk to your pharmacist because they are the specialists in that area. Always consult your doctor first before starting any new supplement too. Thank you so much for that question. That's it for today's 5-minute focus. Research on the gut's role in gout is still emerging, but it's great to see how microbiome science might change how we manage chronic conditions like hyperuricemia. And if you found this episode helpful, please subscribe, share, and send in your questions. It might show up on a future episode. Your health is in your hands, and knowledge is the first step toward better wellness. Until next time, stay informed, stay empowered, and please take care.